It's been a pleasure for me to work with a whole bunch of the scientific committees here at the agencies, both with regards to sort of short-term operational type issues and then more longer term. I'm very struck this is the last session of a Friday with everybody heading off for the weekend, and you've had a very content-rich agenda up till now. I'm also very struck that we leave the complicated landscape of combined medicines and device development into the much clearer landscape of Brexit and everything Brexit-related. Yeah, so. And I really think, if you then judge at the end of the two sessions, which was the more complicated, we could have a very good voting competition on that. So, but on a more serious note, I've been working with a whole bunch of our colleagues. We set up this thing called an ORP task force, which was operational, relocation, preparedness task force. And we pretty much set that up almost day one after the referendum. And the whole focus for us inside the agency was we have to move home. So I don't think I'm surprising anybody or breaking any confidentiality to say is we are unfortunately leaving this building, because we very much like this building. We only moved into it a number of years ago. And we are moving to a very nice building or series of buildings in the Amsterdam area. And this sort of, Brexit is sort of, has it been a long time? It seems like it's been forever in the news, but equally it also seems a very short time, certainly for the colleagues inside this house here, because we are physically moving now and it's becoming very, very real. As of February next year, we'll be running out the last few meetings in these sort of rooms, the various committees, working parties in February, and we pretty much will be ramping up full sort of committee meeting schedules through March. Yeah, so we have maybe 1 week of real transition, the first week in March, when we're not going to be having any sort of scientific meetings, and that's okay with the schedules. But thereafter, we run the full set of scientific meetings uninterrupted in the new location from March onwards. And in terms of a commitment from the agency, what we're very much committed to do is to preserve what we call our sort of category one, our core business processes. And that means for you as both developers and people seeking licenses, access to market, we will keep the lights on. Absolute priority for all of our scientific advice procedures, pediatric advice, orphans, the SME office itself. And we will also keep the lights on absolutely for core business on the centralised procedure, both initial and for post-authorization variation changes. So that's regardless of any other messaging you've got about this might be stopping, this might be reducing, whatever, the absolute core business is being preserved as top priority. And to say it'll be a seamless transition, that's a very trite thing to say, but we're sort of aiming to be as less disruptive as possible. I think it's probably better language. In terms of what we have here on the screen, just if you're curious, I tried to show the three main things about Amsterdam. The bottom left is the airport, Schiphol, and there's no doubt it is an excellent airport, fantastic European and international connections. So from that point of view, people flying in to have a conversation, doing some work with us as an agency, it's really facilitated by having world-class airport facilities as well as train facilities, etc. That's the first thing. The second thing is, when you're going to visit us, hopefully some of you will be coming to see us in March, in our new home, as it were. It'll be in the Spark building, which is sort of there at the top of the screen. So Amsterdam is a bit of a funny city, really, but I suppose it's sort of northwest, if I can sort of describe it that way. But our eventual building, back end of next year, the new EMEA building, so that's the sort of architect's projection, that's in the sort of south, yeah, I think south, Amsterdam south, I think. I'm looking at my Flemish colleague there who can give me that sort of guidance, But as I say, it's a little strange geography. But so hopefully we'll see some, or if not all of you there in the new build. And it is just simply to say, for us, this thing is happening. And I suppose that's the key message that we're going to go through, because Leonor will now guide you through the various series of sort of situations and scenarios that you find yourself in, if you have SME status, if you have orphan status, etc., and how we're advising you to navigate that. And we really are, we're relocating, we're moving, and the basic headline message to you as an industry grouping is, you need to engage with this and make certain things happen if you also want to have continuity of service provision. And I think with that, then I hand over to Leonor, who will get you into that detail, and let's judge the level of complexity at the end of it vis-a-vis what you just heard in the previous session. So thank you, Leonor, please.
Thank you, Tony. Good afternoon to everybody. It's a pleasure to be here today and to meet face-to-face all the SMEs that we interact on a daily basis. So in terms of my presentation, what I would like in terms of the aim of this presentation is to be clear and to present facts in a simple way. I think this presentation managed to do that. EMEA has been providing available guidance related to Brexit. Thank you. And based on that available guidance, I will guide you through on the questions that we identify as the main priority aspects that you'll need to consider, whether you are a UK-based SME or whether you are dealing with developing a product in each. So at the phase of development, or if you have an ongoing marketing authorization, or if you already have approved marketing authorizations, what are the key aspects that you will need to take into account? So this will not be an exhaustive list, but will highlight important aspects and also refer to the guidance that is available. And to finalize, I will give you an update on the implementation of the redistribution of the UK centralized portfolio. So in terms of available guidance, this is published at the EMEA website. We have the notice to marketing authorizations, a document prepared by European Commission and the EMEA. And this document states that unless a ratified withdrawal agreement establishes another date, UK will become a third country from the 30th of March 2019. Together with this document, EMEA and the European Commission provide a set of question and answer documents which provides this legal interpretation of the principles to be applied in a consistent manner across the pharmaceutical network. EMEA has also produced a practical guidance, and this document needs to be read in conjunction with the question and answer and gives, as the name indicates, a more practical guidance and complements all the other, the above documents. So, coming to the first question, I am a UK-based SME. How can I continue to benefit from the SME incentives? Because indeed, the aim of this session is that you continue to benefit from the SME incentives, and also that allows you to prepare for Brexit. So there are two options, and the basis for these options is the guidance available for non-EEA-based companies. There are two possible ways. You can establish a new legal entity in the Union and apply for the SME status directly. And this is indeed the preferred option that we would like you to take. And that this new entity will be qualified and active before the 29th of March 2019. Another option that you have that is also available is to come indirectly via an established SME regulatory consultancy. In this case, both the non-EEA company and the consultant, both they need to meet the SME criteria in terms of headcounts and financial thresholds. And the regulatory consultancy receives the SME notification, and the non-EEA-based company is listed as an annex to that notification as an SME client company. You can see for each of the situations, I've highlighted either the Q&A or the practical guidance and the question that gives you the relevant guidance. So we've also produced some statistics, and as you can see, we have at the moment 1,861 SMEs registered with the EMEA. Out of these, 286 are UK-based SMEs. And we also try to capture from those SMEs which ones are already preparing themselves and creating new entities and qualifying these new entities. And we have captured 15 UK-based companies that have contacted. 10 of them have already qualified. 5 of them are undergoing qualification. So this is, as you can see, this is a very small number compared to the number of UK-based SMEs. So just to alert, this awareness session is also a call for you to start to prepare, and the sooner you do it, the better, because we are still running with almost all the staff, but we have a move, and the sooner you prepare yourself, the sooner you interact with us, the sooner we can deal and we can support you. So now I'm going through the different phases of the development, and for you to check what are the aspects that you need to take into account. So in terms of development of medicines, and you are SMEs, and SMEs have almost 50% of the orphan designations. And one aspect that is very important is transfer of the orphan designation. So there is a need to transfer to a sponsor established in the union, or to change the place of establishment in union in case you are an individual entity. So this is free of charge, and an application needs to be submitted. I have included the guidance, and there is also the checklist to support you. We have created a contact point for orphan drugs, and also I've included the practical guidance, question 5, to support you. As I mentioned before, the practical guidance are quite detailed and give you really a very clear view of what do you need to do to transfer the orphan designation. In terms of pediatrics investigation plan and waivers, there is no requirements of an establishment in the EU or in the EA, so you don't need to take actions on those. In terms of developing of generics, hybrid and biosimilars, generic, hybrid and biosimilars, they rely on data of the reference medicinal product that is or has been authorized in the Union. And the guidance available states that marketing authorizations granted before the 30th of March 2019, they remain valid even if the reference product is authorized in the UK. On the other hand, if they are granted after the 29th of March 2019, the reference product is or has been authorized in the EU27 EEA. So if you are in the situation that you are in risk of having a marketing authorization granted after the 29th of March and you use a reference product authorized in the UK, you should contact us immediately so that we can see what are the options, what are that, and how to deal with that. In terms of ongoing marketing authorizations, so marketing authorization applicants, after March 29th of March 2009, the applicant needs to be changed to a non-UK applicant established in the Union. Once more, the practical guidance is available and is detailed, but also on top of that, there are other updates you may need to perform, like the UK qualified person for pharmacovigilance master file, batch release and batch control sites, identified official medicinal control laboratories, and nominated local representatives may also need to be changed. We have also included some statistics, and in terms of statistics, what I wanted to highlight to you is that at the moment, and these are only SME statistics, we have in total 16 SMEs ongoing, marketing authorization application, and out of those, 10 have UK as an applicant. So I urge you to update as soon as possible to an applicant that is established in the EU27 or in the EEA. So now going to the marketing authorizations. Changes required include if you are a UK marketing authorization holder, if you have a UK QPPV, or pharmacovigilance master file located in UK, if you have a UK batch control site, a UK batch release site, or if you need an importation site for products manufacturing in the UK. So I've also included some statistics here, and also to highlight once more in terms of total marketing authorizations held by SMEs. We have 31 in total, and out of those, 20 belong to SMEs. Once more, these 20 marketing authorizations need to be transferred. There is guidance available on marketing authorization transfers. As I mentioned, marketing authorization transferred to a holder in the Union is required. This process is relatively simple and can take up to 1 month, but if, for example, you have also an orphan drug that you need to transfer the designation, so you need to transfer the sponsor to a sponsor established in the Union, then it can take a bit longer. So we urge you to act as soon as possible, because these transfers need to be fully completed and implemented before the 30th of March. For the marketing authorization transfers, we have also created a mailbox for you in case you have questions and practical guidance. So for all the questions related also to product-specific marketing authorizations, you have also the contact of your procedure manager, and you should liaise with them whatever the changes that you need to require, so that he's fully aware and can support you. So other aspects that you need to take into account: UK qualified person for pharmacovigilance must reside and carry out his or her tasks in the EA member state, and the pharmacovigilance master file also must be located within the EA. And we've included some guidance on what do you need to do that. But these changes are notifications through Article 57 database, so are quite simple administrative changes. In terms of manufacturing and supply, so in terms of manufacturing, you can still have products manufactured in the UK, but in this case, you need to have an imported site located in the Union. In terms of batch release, batch control and batch release sites, these, according to the legislation, needs to be conducted in a site in the Union. And also for OMCL, so official control batch release for specific type of products, these controls need to be conducted in an OMCL in the Union. I'm not going through these slides, but you have them. They will be published and they refer to the appropriate guidance. What I want to go through is to this slide, and these and we've extracted part of the information on the question 2 of the practical guidance. And what I wanted to highlight is that there is a list of possible changes that you may need to perform, and the different scopes in terms of variations. And most of them are very simple type 1A variation, although there are some exceptions for that require type 2 or type 1B variations, but most of them are type 1A variations, and you have all the guidance available. I've already mentioned the official medicines control laboratories. In terms of medical devices, so in terms of CE marking, there is a EC notice on industrial products, and I've included there a link that you can look at. But in terms of us, what is the impact? So this CE marking, supported by UK notified bodies, need to apply for a new certificate issued by an EU 27 notified body or arrange a transfer. And this applies for medicinal products that are co-packaged with a medical device CE marked based conformity assessment by a UK notified body. So there is a need to update the documentation, and you can also remove or replace the device. And for that, we have also question 2A from the practical guidance that gives you, it's not an exhaustive list, but gives you several options and the appropriate type 2 variation. So once more, the guidance available is quite detailed. So now, and I would like to give you an update in terms of the implementation of redistribution of the UK centrally authorized products portfolio. All the rapporteurships, all the new rapporteurships were already communicated to marketing authorization holders, and this was done back in April. The new rapporteurs will take full responsibility for the reallocated products as of 30 of March 2019, when the UK withdraws from the Union and becomes a third country. The MHRA will be accountable for the medicinal products for which they are rapporteurs until the 29th of March 2019. However, the new rapporteurs may be required to handle from Q4 2018 onwards post-authorization procedures when it is envisaged that the procedures may be still under evaluation after the 30th of March 2019. So this decision is taken at a procedural level and depending on the average length of the procedure. And cut-off dates for each procedures are published at the EMEA website, taking into consideration the deadline of the 30th of March 2019. So with this, I've concluded my presentation, but I would like to once more highlight key messages, and the message are the following: prepare for Brexit, and this means to work on a scenario that UK will be a third country on the 30th of March 2019. Use all the available published guidance. Use also all the opportunities that you have to interact with us, be in pre-submission meetings that will be offered as teleconference due to our relocation, but they will continue to be offered. Also, for product-related queries, liaise with your procedure manager as early as possible. Submit change promptly. If you have general queries, you can ask them via Ask EMEA, and of course contact the SME office for support to continue to benefit from the SME incentives. So I think now I've completed my presentation.